Good day, everyone. Welcome to Wally's Nursing Videos as we start today's comprehensive lecture where we will delve into the intricate realm of musculoskeletal disorders. Before we dive into the specifics, let's initiate our journey by reviewing the anatomy and physiology of bone structures and the functions of bone cells. A&P Review: Bone Cells and Functions. Bony Structures. Now, let's explore the functions of different bone cells. Function of bone cells. There are several types of bone cells, each with its own specific function in the maintenance and remodeling of bone tissue. The main types of bone cells include osteoblasts, osteocytes, and osteoclasts. Osteoblasts. Function. Osteoblasts are responsible for bone formation. They synthesize and secrete the organic components of the bone matrix, including collagen. As they surround themselves with the matrix, they become trapped within it and eventually differentiate into osteocytes. Osteocytes. Function. Osteocytes are mature bone cells derived from osteoblasts. They are embedded in the bone matrix and are connected to each other and to osteoblasts through cellular processes within tiny channels called canaliculi. Osteocytes play a crucial role in maintaining bone tissue by sensing mechanical stress and regulating the activity of osteoblasts and osteoclasts. Osteoclasts. Function. Osteoclasts are large, multinucleated cells responsible for bone resorption. They break down bone tissue by secreting enzymes and acids that dissolve the mineral components of the matrix. This process is essential for bone remodeling, repair, and calcium homeostasis. Bone lining cells. Function. These cells are flat, quiescent cells that cover the surface of bones. They are thought to be derived from osteoblasts and may become active osteoblasts or osteoclasts in response to signals. These bone cells work together in a dynamic process called bone remodeling. This process involves the continuous formation of new bone tissue by osteoblasts and the removal of old or damaged bone tissue by osteoclasts. The balance between bone formation and resorption is essential for maintaining bone density, strength, and overall skeletal health. Moving forward, we will unravel the hormonal processes governing bone formation, metabolism, and remodeling, with a keen focus on the roles of parathyroid hormone, PTH, calcitonin, and vitamin D. Hormonal influences on bone tissue. PTH. Originating from the parathyroid gland, PTH is a pivotal regulator of calcium and phosphate. It enhances blood calcium levels by releasing calcium from bones, conserving calcium in kidneys, and facilitating intestinal absorption through vitamin D activation. Simultaneously, it reduces serum phosphate levels. Now, let's transition to musculoskeletal trauma and infection, with an emphasis on fractures and osteomyelitis. Musculoskeletal trauma and infection. Fractures, types and clinical manifestations. Fractures, a common consequence of musculoskeletal trauma, come in various types. Understanding these types is vital for effective diagnosis and treatment. 1. Transverse fracture, a fracture line perpendicular to the bone's long axis. 2. Oblique fracture, a diagonal fracture line across the bone. 3. Spiral fracture, a twisting break often caused by a rotational force. 4. Comminuted fracture, bone breaks into multiple fragments. 5. Segmented fracture, the bone fractures into two or more non-adjacent segments. 6. Butterfly fracture, a fragment separates from the bone shaft, resembling a butterfly's wings. 7. Impacted fracture, one fragment is driven into the other. Phases of fracture healing. 1. Hemorrhage and inflammatory response, 1-5 days, blood clot forms, and a fibrin meshwork provides a framework for inflammatory cells. 2. Procallus formation, osteoclasts synthesize new bone. 3. Bony callus formation, 3-4 weeks. Osteoclasts remove dead bone, and compact bone replaces spongy bone. Osteomyelitis. Definition: a bone infection, often caused by Staphylococcus aureus. Signs and symptoms: fever, malaise, chills, pain, tenderness, swelling, and leukocytosis. Management: long-term treatment, 4 weeks to 6 months, central line placement, and occasionally prosthesis removal. Compartment syndrome. Definition: increased pressure within a confined space, compromising tissue function. Causes: trauma, casts, dressings, and massive edema. Signs and symptoms: 6 Ps. Pain, paresthesia, pallor, pulselessness, polycothermia, and paralysis. Early recognition is crucial for limb preservation. Now, let's pivot to disorders of the skeletal system, encompassing metabolic and rheumatic disorders. Disorders of the skeletal system, metabolic and rheumatic disorders. Osteoporosis. Definition: a metabolic bone disease leading to increased porosity and fracture susceptibility. Risk factors include being female, thin, white or Asian, family history, smoking, a diet low in calcium, postmenopausal status, advanced age, and a sedentary lifestyle. Rheumatoid arthritis, RA. Definition: a chronic autoimmune systemic disease with extra-articular manifestations. Prevalence: affects 1–2% of the population, primarily women. RA. Clinical manifestations: local symptoms, pain, stiffness, limited ROM, signs of joint inflammation. Extra-articular symptoms: fatigue, weakness, weight loss, low-grade fever, elevated ESR, anemia, splenomegaly, and visual impairments. RA. Diagnosis and drug therapy. Diagnosis: positive RF, moderate anemia, elevated ESR, and CRP. Drug therapy involves NSAIDs, DMARDs, e.g., methotrexate, and biologics. Systemic lupus erythematosus, SLE. Definition: a chronic inflammatory disease affecting connective tissue. Prevalence: more common in women, particularly in certain ethnic groups. Signs and symptoms of SLE: joint pain and swelling. Arthritis, often involving the joints of the fingers, hands, wrists, and knees. Skin manifestations: butterfly-shaped rash on the face that covers the cheeks and bridge of the nose, malar rash. Skin rashes that may worsen with sun exposure. Discoid rash, characterized by raised red patches. Fatigue, persistent and overwhelming fatigue. Fever, low-grade fever or recurrent fevers. Photosensitivity, increased sensitivity to sunlight, which can trigger or worsen skin rashes. Raynaud's phenomenon, color changes in the fingers and toes in response to cold or stress. Hair loss or thinning. Mouth and nose ulcers. Mouth ulcers, oral ulcers, or nasal ulcers. Chest pain and shortness of breath. Inflammation of the lining around the lungs, pleuritis, or inflammation of the lining around the heart, pericarditis, which may cause chest pain and difficulty breathing. Kidney involvement. Inflammation of the kidneys, nephritis, which can lead to proteinuria, excessive protein in the urine, and other kidney problems. Neurological symptoms. Cognitive dysfunction, memory problems, or confusion. Headaches and migraines. Seizures. Gastrointestinal issues. Abdominal pain. Nausea and vomiting. Blood disorders. Anemia, low red blood cell count, and leukopenia, low white blood cell count. Increased risk of blood clotting. Osteoarthritis, OA. Pathophysiology, imbalance in the extracellular matrix, leading to joint degeneration. Clinical manifestations: joint stiffness, limited ROM, pain, and inflammation. Management focuses on weight-bearing exercises, proper nutrition, and pharmacologic interventions. Gouty arthritis, gout. Definition: characterized by increased serum uric acid and urate crystal deposits. Causes: overproduction or decreased excretion of uric acid by kidneys. Pathophysiology: uric acid crystal precipitation leads to inflammation and joint damage. Gout. Pharmacologic management focuses on reducing uric acid production or enhancing elimination. Back pain. Lastly, we'll touch on back pain, a prevalent issue affecting 70% of adults. Risk factors include smoking, heavy lifting, obesity, and depression. Causes: disc herniation. Description: intervertebral discs act as cushions between the vertebrae in the spine. A herniated or slipped disc occurs when the soft inner portion of the disc protrudes through the tough outer layer, putting pressure on nearby nerves. This can result in pain, numbness, or weakness in the back and sometimes radiating down one or both legs. Sciatica. Common symptoms: sharp or shooting pain, numbness, tingling, or weakness in the affected area or down the legs. Cancer. Description: cancer can affect the spine, leading to back pain. Primary tumors originating in the spine or metastatic tumors that spread to the spine from other parts of the body can cause compression of the spinal cord or nerves. Tumors can weaken the bones, making them more susceptible to fractures. Common symptoms: persistent, progressively worsening back pain, especially at night. Pain may be accompanied by other symptoms depending on the type and location of the cancer. Spinal injury. Description: injuries to the spine, such as fractures or dislocations, can result from trauma, accidents, or falls. These injuries may damage the spinal cord or nerve roots, leading to pain and neurological symptoms. Common symptoms: sudden and severe back pain, difficulty moving, loss of sensation, muscle weakness, or paralysis depending on the severity and location of the injury. Muscle or ligament strain. Description: overuse, improper lifting, or sudden movements can strain the muscles and ligaments in the back, leading to pain. This is one of the most common causes of acute back pain. Common symptoms: dull, aching pain, stiffness, and limited range of motion. Pain may be aggravated by certain movements or positions. Degenerative disc disease. Description: over time, the intervertebral discs can degenerate, losing their cushioning ability. This natural aging process can lead to pain and reduced flexibility in the spine. Common symptoms: chronic, low-grade back pain that may worsen with activities and improve with rest. Pain may also be accompanied by stiffness. Spinal stenosis. Description: spinal stenosis is the narrowing of the spinal canal, which can put pressure on the spinal cord and nerves. It may result from aging, arthritis, or other degenerative changes in the spine. Common symptoms: pain, numbness, or weakness in the back and legs, especially with walking or standing for extended periods. Neurogenic claudication. Wrapping up today's session on musculoskeletal disorders for Wally's nursing videos, I want to extend my appreciation for your active engagement. Delving into the complexities of bone physiology, hormonal influences, fractures, and skeletal disorders is crucial for nursing professionals like yourself. If there are any queries or if you need further clarification for your nursing community, feel free to reach out. Your dedication to expanding your knowledge in healthcare is inspiring. Thank you for tuning in, and I'm excited about the continued learning journey with Wally's nursing videos.